Health is the most valuable asset, and for persons suffering from chronic illness, things may go extremely wrong. If you or a loved one has a chronic disease, you know how dreadful it is to realize that you have run out of supplies and must reorder some. Insurance companies may inform you that they are no longer reimbursing the medicine or that there is a nationwide shortage with no end in sight. Now consider the life of such people in Lebanon during the current economic collapse. It's a fate you wouldn't want on your worst enemy. Please, allow me to offer my first-hand experience from Lebanon amid the economic collapse and medicine shortages. I will inform you which chronic condition meds have become rare or problematic, so you can plan ahead of time. Because on this channel, we hope for the best, but we prepare for the worst. The real-world experience of Lebanon that I will share with you is from my uncle who works in a pharmacy, not from some ChatGPT or generic preppers article. This is the direct shortages he observed in his office, which occurred the quickest and are the most troublesome. Again, please use the Lebanese experience to really prepare yourself because there are people dying in Lebanon as a result of these shortages. See this video where I talked about it more. I've divided this treatment into 5 categories to make the video easier to follow. Each time I will give you the commercial name, but it's most likely only a commercial name for the Middle East. So that's why I will also give you the molecule name so you can see if it corresponds to your own medications. Also, I'm a biologist, not a physician or a pharmacist, so please double check whatever I will say, and sorry in advance if I pronounce the molecule name wrong. The first category is anti-diabetic medications. In general, anti-diabetic medications work by lowering blood sugar levels, either by increasing the insulin secretion or efficiency, or by decreasing the absorption of sugars by cells. These categories include 4 common oral anti-diabetic medications. The first is Farxiga, and the molecule name is dapagliflozin. It blocks the reabsorption of glucose by the kidney and so helps the elimination of glucose in the urine. The second is Novonorm, and the molecule name is repaglinid. It increases the pancreatic insulin secretion. Onglyza, the third medication, contains the active ingredient saxagliptin. It boosts the pancreatic insulin secretion while decreasing the glucagon secretion. The fourth medication is Combogliz, which combines the saxagliptin that I just mentioned and the metformin that improves the insulin sensitivity, especially in the muscles and the liver that store the sugar. For those who are unfamiliar with diabetes, regular exercise and a healthy diet will not allow every patient to control their blood sugar, and they will require these medications to do so. And sometimes, the blood sugar control requires the combination of 2 anti-diabetic with different modes of action. And every diabetic will tell you that when the blood sugar is not well controlled, it can lead to a range of serious health complications such as cardiovascular disease, kidney damage, nerve damage, amputations sometimes, blindness, and even death. So clearly, not having access to this medication is very troublesome for them. The second category is the chronic medication for neurological disorders. This category includes Risperdal, a medication whose active ingredient is risperidone. It's used to treat people with schizophrenia, bipolar disorder, children with severe behavioral problems, and people with Alzheimer's disease. Another drug is Keppra, an anti-epileptic medication that contains the active ingredient levetiracetam. Its goal is to eliminate or at least to reduce the frequency and severity of epileptic seizures. Another anti-epileptic drug in shortage in Lebanon is Convolux, derived from valproic acid. And finally, there is an antidepressant called Zoloft, which contains the active ingredient sertraline. It's used to treat depressive states and to prevent recurrence of depressions in people, but also for panic attacks, post-traumatic stress disorders, and obsessive-compulsive disorders. I would like here to emphasize the importance of these drugs in a crisis-ridden country. You have no idea how depressed the Lebanese are and how many people commit suicide. The Lebanese have lost money due to bank freeze and devaluation. Their salary only lasts for a few days and everything is very expensive. They see people close to them getting sick and dying without being able to do anything. And an explosion in Beirut killed more than 250 people. People are really depressed, and when they try to see a psychologist, it's either prohibitively expensive or affiliated with a scam organization. Furthermore, people who are unfamiliar with mental health disorders may be unaware, but it is a painful process for these patients to find a molecule that works for them and that they can tolerate. Switching from one molecule to another is a terrible challenge for these patients. The third category is a drug class called I haven't liked this video despite being halfway through. So go on, please like this video, subscribe and leave a comment for the algorithm. If you love my videos and want to see more of them, you can support me on Patreon, Buy Me a Coffee or other platforms. This will allow me to continue making free videos while also directly supporting people in Lebanon. Now, the real third category is cardiovascular drugs. Probably the type of chronic medications where shortages can be the most dramatic the most quickly. There is Atacant, whose active molecule is condersartan. It's used to treat high blood pressure, but it also can be used to treat heart failure in some cases. Another drug is Brilinta. The molecule name is ticagrelor. It's an antiplatelet aggregation agent. It's typically used as a supplement in the prevention of heart attacks and strokes. It's also used in patients who have coronary stents. Another drug is Lovenox. Molecule name enoxaparin. It's an anticoagulant of the low molecular weight heparin family. It prevents the formation or the spread of clots in the blood vessels, and it plays an important role in the treatment of acute coronary syndrome and myocardial infarction. Another drug is Atozet. It contains the active ingredients ezetimibe and atorvastatin. Atozet is an adult medication that lowers total cholesterol, bad cholesterol, and triglyceride. The first category is respiratory and lung diseases medications. This category includes Anora ellipta, a combination of two molecules that I can't pronounce right. It's used to treat the symptoms of chronic obstructive pulmonary disease, COPD, in adults. It's available in the form of an inhalation powder contained in a portable inhalator, and it's used in a routine maintenance treatment. Another problematic drug for COPD is the Seretide inhaler. It combines these two molecules, and it's also used in certain cases of asthma. The third drug in shortage is Pulmicort. It's used to treat asthma, and it contains the active ingredient budesonide, a corticoid with anti-inflammatory properties on mucous membranes. The fifth category is drugs for eye diseases. Cosopt, a combination of dorzolamide and timolol, and the drug Lumigan, molecule name bimatroprost, are both eye drops that treat glaucoma by lowering the elevated intraocular pressure. Although it's not the most life-threatening condition, losing my sight is my greatest fear. Also, I wanted to mention that I am able to bring a large amount of eye medication for my father's treatment because it's accepted in Europe with a foreign prescription, but I'm not sure if this is true for the other medications. People suffering from chronic illnesses should have a plan in place in case of a medication shortage or unavailability. This could include stockpiling medications when possible, collaborating with a healthcare provider to find alternative treatment options, or arranging for medication to be shipped in from other countries. When your country's economy collapses, it can have far-reaching consequences for your way of life, not just in terms of medicine shortages, but also in terms of essential goods such as food and energy. I discussed these in this video and tell you also how to prepare for these other shortages. If you have any questions about healthcare in Lebanon right now, don't hesitate to leave a comment. You can support me on Patreon or buy me a coffee, and we can stay in touch on Twitter and Instagram. A special thanks to my Patreon and YouTube super thankers. You are the MVPs that help me continue to do these free videos.